Welcome back. You're watching In Focus, and it's time again for our In Focus Health Update.
And joining us now is health reporter Linord Moudou. Hello, Linord.
Hello, Vincent. Hello, Dumiaki.
Welcome back.
Welcome, and we know you're going to tell us about a very strange illness in Uganda and a major problem with prescription drugs here in the United States. Yeah?
Absolutely, absolutely. But first, in northwestern Nigeria, Zamfara State, hundreds of children have died from lead poisoning, and thousands of others are being affected. The poisoning cases in Zamfara started in 2010. Human Rights Watch says high levels of lead in the earth linked to the illegal mining of gold and the use of rudimentary mining methods are believed to be a leading cause of the epidemic. In late 2011, Zamfara State assigned a cleanup team to the most affected areas, but more help is needed as children continue to get sick and need treatment. Excessive lead can cause irreparable damage to the kidneys and nervous and reproductive systems. It is especially harmful to young children. Pregnant women may pass the toxic metal to their fetuses and newborn babies when breastfeeding. A mysterious illness in northern Uganda has parents concerned and researchers confused. Michael Odonkora takes his daughter Nancy Lamwaka outside of the family's small hut and ties her to a mango tree. Tying his daughter to the tree is not something Odonkora likes to do, but he says the disease that gives Lamwaka violent seizures has also diminished her mental capacity, and she often wanders off.
It hurts me so much. In our tradition, it's a taboo. It's not something heard of that you would tie someone to a tree. I want to save her life. I don't want her to go and drown in the river nearby. I don't want her to fall in the fire. The wounds on her fingers are from falling in fire.
Lamwaka has frequent seizures, up to 5 times a day. The 12-year-old is suffering from nodding syndrome. Named for the seizure-like episodes of head nodding it causes, the syndrome has killed over 200 children in Uganda since it was first reported in 2009. The World Health Organization says it is affecting over 4,000 children in northern Uganda. Experts do not know the origin of the illness or how to treat it. Odonkara has watched his daughter's health slowly deteriorate since she first contracted the disease in 2004. At first, local doctors said it was epilepsy, but after treatment failed, they found out the girl was suffering from something more mysterious.
I'm not very optimistic. There were several tests that were done, but we haven't seen the results yet. But we keep going to the hospital in case they find a solution. If they don't find a solution, my daughter is as good as dead.
Experts say children who have nodding syndrome have difficulty eating. They say the seizures are often triggered by food. As a result of not eating well, these children become mentally and physically stunted. Dr. Emmanuel Teniwa is an advisor for the World Health Organization.
The issue is that there is a general effect on their neurological system to the extent that some can be impaired in vision, in eating, even in mere recognition of their immediate environment. So that's why we are calling it a syndrome, because not all are really manifesting the same way. Some may just have a few of these features.
Dr. Teniwa says most of the fatalities attributed to the disease are the result of secondary causes.
I would say in terms of mortality, the disease itself doesn't kill, as you would expect. But it is just because it cripples you and then it subjects you to poor living condition and what have you. Then secondary to that, you will find that you are dying.
Nodding syndrome mostly affects children under 15. It was first documented in Tanzania as early as 1962. Researchers are still largely confounded by it. The U.S. Centers for Disease Control and Prevention, the CDC, is working with Uganda.
We've done extensive laboratory investigations trying to find the cause for nodding syndrome. In fact, we've ruled out more than 36 different possible causes for nodding syndrome, including some of the most recent results looking for 18 different viral families encompassing literally hundreds of individual viruses, all negative for nodding syndrome.
Investigators are now focusing on finding a treatment for nodding syndrome. Along with the Ugandan Ministry of Health, the CDC says it plans to conduct trials on several different types of seizure medication as well as supplements of vitamin B6.